Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will look into one of the important topics. So what exactly mean by CD4 count? What is that CD4 actually? See, basically there are three main receptors. Receptor is a protein that is present on human cell. In every human cell there will be a protein. These proteins are called receptors. These receptors are very important for normal physiological function. Each receptor will have a specific function in the human body. In the same way, in HIV there are three receptors that are very important. First one is CD4 is a receptor, basically that is a protein, and also CCR5 is a receptor, and also CHCR4 is also a receptor. So these are the receptors that are present in every human being, and these receptors are specific function in human being. What HIV does is it makes use of these receptors which are designed for a specific function, and this HIV virus enters into the human body, human cell, by using these receptors. Basically it is like a parasite. The important things which are present in our body, the HIV virus makes advantage of it, sticks to it and enters into the human body. There are some specific type of cells on which CD4 receptors are present. CD4 receptors are present in T helper cells. Basically these receptors are present in our immune cells. HIV virus takes advantage of these receptors and enters into the human cells that are protecting our body. First one is CD4 receptors. CD4 receptors are present in T helper cells, monocytes, macrophages, dendritic cells and microglia. These are all different immune cells present in your body. In the same way, CCR5 is present in monocytes, macrophages and dendritic cells. The next one is CHCR4. This is present in T helper cells. So these are all the basic proteins which are essential for our body. This HIV gains entry into our body by sticking to these receptors.
Fidicus Homeopathy.